everyone. Hi, everyone.
Hello.
Welcome. Hi, guys.
Hi. Good evening.
Welcome to the Dr. Roz Show podcast. I'm so excited. This is our season 2 opener, and I have fantastic guests with us tonight. I am so excited, primarily one, because it's my Fiskite family. You know, I was telling someone the other day, you can get any and everything you need from a Fiskite. And so when I was thinking about doing this show, and I saw you guys posting about getting your vaccinations, I was like, we have to do a show about this. So I am so happy that you said yes. I am so happy that you are here with me tonight. We'll start with you, Dr. Vikisha Fripp. Can you introduce yourself and tell everyone who you are and everything about you?
Of course. Thank you so much for having me. I'm Vikisha Fripp. I'm a plastic surgeon here in the nation's capital, Washington, D.C. I am based out of the University of Maryland, Capital Region Health, and I also have a med spa here in D.C. for which I do aesthetic work. And it's important for me as a surgeon to talk about COVID because it impacts the way I operate. For example, tomorrow my cases are canceled at the hospital because we don't have any beds. And so COVID is real, and I want people to remember that. Even after we get vaccinated, COVID is still real, and we need to govern ourselves accordingly. And I also want to champion all efforts for people to be vaccinated and to know what the truth is about COVID so we can move forward together. So, Roz, again, we're at this, we pledge the same chapter. We have a bond that is unbreakable in every way.
Indeed.
Our bond that we invite people.
And I should say, this is a whole D9 panel tonight. Vikisha is my sore. Dr. Vikisha Fripp is my sore. And we'll go to Dr. Alicia Sanders. We'll have you tell us about yourself.
Yes, good evening, everyone. Yeah, so I am Dr. Alicia Sanders. I am class of 2002 at Fisk University. I did pledge Delta Sigma Theta Sorority Incorporated. And I am an emergency physician here in Indianapolis, Indiana. So I am definitely a strong proponent of vaccinating. Obviously, I see COVID firsthand. I've seen mild cases, I've seen serious cases, I've seen those who have passed from it. So I am a huge proponent for vaccination for all, and hopefully this talk tonight will help allay some of your concerns so that we can get more people on board with the positivity associated with being vaccinated.
And let me just say that Dr. Alicia is so modest that she didn't even mention that she's a former Miss Fisk.
Oh,
so
yeah.
we are in Fisk royalty right about now.
Well, yeah.
Fisk royalty.
Yeah. Thank you, Dr. Roz.
Yes, thank you. Thank you so much for being here.
Absolutely.
And next, we have Dr. Anthony Watkins. If you could tell us a little bit about yourself.
All right, good evening, everyone. My name is Anthony Watkins. I am a transplant surgeon at NYU Langone Health in New York City.
Wow.
For 98, Bloody Alpha Delta Kappa Alpha Psi. You know, when COVID first hit here in New York City, I was redeployed to work in the ICU.
Wow.
Obviously, they gave me a lot of firsthand experience of seeing multiple people on ventilators, multiple deaths, challenging, you know, conveying information about patients to their families. I'm also highly aware of the disproportionate impact it's had on our community.
Amen.
And so, you know, I think it's important in this age of misinformation to educate people appropriately. I have received the first dose of the Moderna vaccination, and I'm due for my next dose on Monday. But happy. But thank you, Dr. Roz, for including me in this esteemed group. And I hope we can give the people something to digest tonight.
Amen.
Thank you all for saying yes. And I must say that Dr. Corey Scruggs may come in. He's our cardiologist that's on the panel. He's a member of Alpha Phi Alpha Fraternity Incorporated. But right before we went live, he got hit with he was working tonight. He got hit with 2 heart attacks. So he had to go, save people. So if you see him come in, don't be alarmed, guest, because he He's going to try to come in if he can. I want to say to all of you guys that are listening, if you have questions, all of our Facebook and YouTube watchers, if you have questions, go ahead and put them in the chat. Our guests tonight have been very open to the idea of answering your questions. So go ahead and put them in the chat. No question is a dumb question. I'm pretty sure that, you know, you can't pay for what you're about to get right now. This consultation. To my guests, I absolutely want to say thank you. Thank you for being on the front lines. Thank you for working hard. Thank you for saving lives. Thank you for saving people that look like us, because we know that we have been um, just attacked. Our community has been attacked by COVID-19. And as we were talking, we were saying that it's almost a year that we have been in this situation. So, because you guys work in different facets of the medical field, I wanted to ask you guys, what has been the changes in that you guys have seen in your field? So we'll start with you, Anthony, Dr. Anthony, Dr. Watkins.
Right. So, you know, I deal with a special group of patients because they're immunocompromised, right? So transplant patients have to receive special medication to suppress their immune system so that they can accept their, you know, organs. So obviously that puts them at a higher risk for COVID. And, you know, unfortunately, the data has pretty much conveyed that higher rate of infections and morbidity in transplant patients. So we, you know, initially we had to pretty much halt transplants until we could, you know, further define this disease process and kind of develop best practices on how to still take care of our patients safely in this new environment. So we are now back, you know, up and running. We're transplanting, you know, at, you know, pretty much at a regular rate, but, you know, we do have to take extra steps. So whenever a patient comes in for a deceased donor transplantation, we have to test them for COVID. And we've had situations where patients come in and they're positive. We have to send them home because we obviously can't have a patient with active COVID infection and then giving them immunosuppression medication. The good news is that the CDC, so the first vaccines weren't tested in transplant patients, but they're ongoing trials now. But the CDC has officially recommended that our patient population does receive the vaccine. So we are now currently vaccinating patients who are at least 6 months out of transplant, and other symptoms the same. So we're starting to slowly recover, and you know, hopefully, you know, the vaccine will be part of a multi-pronged approach to allowing us to take care of our patients effectively.
Good. That's great to hear, because we heard when this first started that everything was just kind of shut down. So a lot of people were impacted, you know, that had other health issues. They were impacted during this time because COVID was so scary. And I you know, just can't even imagine. I can't imagine trying to do surgery and not knowing if people are compromising you. You know, and you know, that leads me to you, Dr. Alicia Sanders. You know, you've spoken with my audience before on how to survive COVID, because you are a COVID survivor. And so what have you seen thus far? What are the changes that have been made? And if you want to talk a little bit about your experience in regards to what you did. All I can remember you saying is that you kept moving.
I kept
moving. Yeah. And that was so profound. I had one of my best friends, unfortunately contacted COVID. And it was the first thing I told her. I was like, keep moving, don't stop, keep moving, because I remember you saying that. So what are some of the things that you've seen?
In terms of the emergency department, we found that early on, of course, people were afraid to come to us. So they might come, you know, I think I have a sniffle, or I think I'm feeling a little short of breath. But because we weren't doing as much testing in the beginning, they were just staying home. And then unfortunately, that meant that some of the more serious things like heart attacks and strokes, those were unfortunately passing away at home. So we had a lot of illness and morbidity and mortality at home versus in the emergency department and in the hospitals where we could take care of them. Now, fast forward 6 months, we're doing more testing. People are not afraid to come to the hospital, and so you're getting everyone with the whole gambit. Over the summer, our numbers went down, which was good. But then now, since about October, we've gone back up in a horrible fashion, unfortunately. So we're still seeing the people who are extremely sick. We're starting to build COVID tents again, which means that if you think you have COVID, you go to this special area, and we have these special people who are going to take care of you and give you dedicated COVID care, because we're doing our best to keep COVID out of the hospital so that all the COVID is together and all the non-COVID is together. And if we can keep the majority of the people, if we can focus all of our resources that, that can combat COVID in one area, we're hoping to keep more people alive. So what we're finding is that the sick are still very, very sick. They are needing to be intubated, so they have a tube down and they're having things, a machine breathe for them. And a lot more people are getting on ECMO, which is something we weren't doing so much in the spring. So extracorporeal membrane oxygenation. So basically, we wash their blood, we oxygenate their blood for them. So we're doing a lot more of that, and we're seeing a lot more survival with that. And then one of the other things that we've seen that we didn't have in the spring is free or a greater amount of monoclonal antibody. So remdesivir and bamlanivimab, big words, just monoclonal antibodies that are more available in many hospital systems across the country. That's what we're using for the people that aren't as sick. So they are sick, and they have a risk of getting even more sick. So we're giving them this monoclonal antibody to prevent them from getting as sick. And we have found that it is showing improvement. If we catch them in their first 3 days, and they're not having a huge oxygen requirement or anything like that, we're seeing some success. We're bypassing hospitalizations, or we're reducing hospital length of stay. So those are two major things that we have found to be beneficial. I'm telling you, we were shooting from the hip back in the spring. We didn't know, do you give steroids? Do you not? Can you give NSAIDs like ibuprofen? Can you not? Do you give oxygen? Do you put a tube down as soon as they come to the hospital? I mean, we really were experimenting, unfortunately. So now we have a lot more in place that is working. We have already, as you know, the mutated strands have already come to the US. But what we're finding is that this vaccine actually is still effective against it, because it still produces a spike protein. When you get the vaccine, you produce a spike protein. And our body still recognizes, regardless of the mutations. And that's a whole sermon in and of itself. You can change, but we still gonna be able to fight you off. But in terms of myself, yes, that's when I got sick, like I was telling our colleagues here, it was uncool. It was still uncool. It was similar to the plague. Like, what do you have? Stay away from me. And people are a lot less like that now. But I had all of it, loss of taste and smell, which still is, I'd say I'm probably at about 95%. There's still some things that, still don't taste right, still don't smell right, unfortunately. And, shortness of breath, cough, that lasted for a while. And then a lot of people don't talk about the post-COVID side effects. It affects your blood pressure, so your cardiovascular system. It affects your kidneys. It affects your inflammatory markers. All these things that most people don't think about, and that is something that we also need to monitor. It affects your heart. I could go on, but praise the Lord, I'm doing great. Everything is normalized in me. It took about 6 months, but everything is normalized in terms of blood work, in terms of blood pressure. And I have now received my second vaccine dose. So Mom is excited to hurry up and continue to wear her face mask.
Yeah, your story is it's so it's terrifying. It's just very terrifying to hear, because you still had to perform and go to work, and you and your babies, like you have 3 little ones at home, right? It's 3, right?
Yes, it's 3, honey. I sometimes lose count too. Don't worry.
three little ones at home, and your husband, by the grace of God, they didn't contract COVID.
Correct. Amen.
But in the beginning, it was just, I mean, the way medical doctors had to handle coming home.
Right. Oh, yes.
It's just unheard of. I mean, it's scary. It's scary. Vikisha, Dr. Vikisha, I'm going to come to you, but I have a couple of Fiskites who have said, hello, Fiskites, from Andrea Green, from Heidi Turner Prude. Hello, Fiskites. I'm so proud. Kevin Thaxton. Kevin, thank you for your service. I think you're stateside now, but thank you for your service. He's like, hey, Fiskites. And Joey King says, hey, Fiskites. So I was like, let me make sure I get that in. And Dr. Vikisha Fripp, we have you back now. So what changes have you seen? Uh-oh, did she?
Oh, I think she froze.
I think she's frozen. Well, we'll come back. Maybe she'll have to log out.
My question one time.
Oh, there you go. We can hear you.
Okay.
Yeah.
All right, we can hear you.
We can
hear you. That's good. So what changes have you seen from the beginning of COVID to now? Oh, I think it's still choppy.
Yeah.
Dr. Fripp, you may have to log out and log back in for some reason, because we can't hear you. We can't hear you. We did have a question to come in, so I will display that question now. Are you aware of when the Pfizer vaccine will be available? Also, in terms of the medical trials that both the Moderna and Pfizer vaccines went through, was it determined if one is better than the other?
Yes. So what I'll say is that the rollout of this vaccine hasn't been perfect, but the way I've seen it work here in New York is that some institutions, such as mine, received different shipments. The first shipment was the Pfizer vaccine, and people who were in that first tier received the Pfizer vaccine. The second shipment was the Moderna vaccine. I was amongst the second tier, and that's what I received. I think what I've been telling patients and people is, including my mother who reached out to me yesterday, is that you're probably not going to have a choice. Wherever your first option is to get it, it's going to probably be either one or the other. And the good news is that the data thus far has shown that they're both equally efficacious. They both are comparable. So, regardless of your age, your background, etc., one or the other, they're both 2 doses. They both are equally effective. So you're going to be good, regardless of which one you receive.
Awesome. I think we have Dr. Vikisha Fripp back now. Can you hear us?
I can. Can you hear me?
Oh, yes. Yes, we can hear you. We can hear you. So there was a question. Are you aware when the Pfizer vaccine will be available? Also, in terms of the medical trials that both the Moderna and Pfizer vaccines went through, was it determined if one is better than the other?
So I wasn't sure about the first part. Do you mean available to the general public?
I can barely hear you, but I assume you're asking me about the Pfizer versus.
Yes,
is that for me or is that for Alicia?
It's for all of us.
Yeah, it's for everyone.
Yeah, the Pfizer's already.
It's on the screen.
Yeah.
I wasn't sure what.
Yeah.
Yeah. So we're rolling here, and I think most of the states we're at 70 plus. So anyone 70 or older, EMT, healthcare workers can get the Pfizer or Moderna vaccine at this point. And then in a couple of weeks, we'll go down to 60, and then it'll keep going from there. And then the trials, yes. So just like Dr. Watkins said, yeah, they're both at 95% efficacy. So that means that they are effective after 2 doses at 95%. I mean, that's only 5% that, you can't get much better than that. I'm grateful for those odds. And I mean, even after 1 dose, you're still at about 55%, which is still better than none. So that's great. So no, one is not better than the other. I've studied that, and yeah, they're both great. I mean, Moderna did have an African American female working on hers, but but
Great.
the couple that helped develop Pfizer are a couple of color, so that's good too. So I don't know, they're both efficacious though. So either one, if you can get your hands on either one.
So what? Oh, go ahead. I'm
I
sorry.
was going to say there are two other vaccines that are projected to be approved within the next couple of weeks as well. And the good thing about that is that there, as I was alluding to before, there's a unlimited supply. So with the approval of other vaccines, we'll have more supply available for Americans.
So can you take a Moderna and then like a Johnson & Johnson, or it has to be two? It has to be consistent.
Consistent.
And the time frame is different between each. So Pfizer's 21 weeks, Moderna's 28 weeks. The same technology, using the mRNA technology, but they're slightly different. So you have to stay with the one vaccine that you get.
Yes, and then to piggyback, New England Journal of Medicine just came out that they talked to the developers. So like Dr. Watkins said, 28 days for Moderna, but both have been found, like say something happens in that time, you don't actually lose anything if you have to go a little bit further. So some people were concerned, I have 21 days with Pfizer and I'm unavailable until day 29. You can still get it on day 29. They actually found up to 90 days, you can still get it and not lose anything. Obviously, the best is to go ahead and get it after you get that initial shot, but you don't lose anything if you have to go on day 29 or day 30 after getting one of your doses.
Yeah, honestly, I was kind of worried about that because like anything can happen within those 21 to 28 days.
That's true.
So it's just kind of like, what happens if you don't get it?
Exactly. Right.
I think we have Dr. Fripp back now. We have you now, Dr. Fripp. Can you hear us okay?
I can't.
Listen, it's okay. Listen, we have all gotten used to this. It is quite okay. Technology is great until it doesn't work.
Until it doesn't work, exactly.
It is quite okay. So we're saying, Dr. Fripp, what's the difference that you've seen in terms of when COVID first began and what's taking place now?
So when COVID first began here in the District of Columbia, Maryland, Virginia, we went into we closed down. We're in preparations for our emergency rooms to be overloaded with patients. And so we made the provision that our operating rooms would be the next best place to store and house and care for COVID patients. So for me, as a surgeon who does more elective procedures than emergency procedures, we just suspended all elective surgeries for about 2 months, for about 60 days. And so for a practice, that's hard because, when you say you don't operate, I'm not a primary care doctor. So seeing patients is not what I do. I see patients in preparation for operating on them. Yeah. It was difficult to say the least. But we opened up in a tier situation. So we opened up for those patients who have cancer, who needed reconstruction. And we didn't get down to elective surgery until the last rung of that ladder. And so again, it was some time before I started operating again. We've been doing well. We've been getting up to our almost 80% of our pre-COVID numbers now. The issue is now that our hospitals are starting to see a surge because people did not comply with the rules for Thanksgiving and Christmas. And so I was sharing that my cases for tomorrow are canceled. So I have 2 elective cases tomorrow, breast reduction, and then another skin removal surgery that are both canceled because they don't have any beds in the hospital. Were to have an issue that would keep them in the hospital, they would not be able to stay. Right. It really impacts the elective surgeon because we can't it's not an emergency, right? But it does change people's lives. And I think that some people don't get that. They think that what we do is all rainbows and butterflies. But the truth is, it's rainbows and butterflies, but it matters to people, right? And if it's something that you thought would happen, and I told you it would happen, and we met for that reason, you want it to happen. And I think as a plastic surgeon, we always think of the aesthetic part, but there's some reconstructive parts that people go unknown, they go undiscussed. And so outside of just breast reconstruction, we have trauma reconstruction, we have skin cancers, we have vision surgeries that need to be done as well. And so, we're overlooked in that way. And I understand, I do, because it's not trauma, it's not transplant, it's not cardiothoracic. It's not those big things that people need, but at the same time, it's what people need, because I believe if you feel good about yourself, you present yourself better in the world. I do, and I've always believed that. And so there is no small surgery to me, because if it matters to you, it matters to me, right? If it's
I
something
love
that keeps you from smiling, then it matters to me.
I love it.
So I am appalled that despite the restrictions that have been recommended, that we still have not been able to get everybody on board to comply with just wearing a mask, with just
Yeah.
6 feet distance, with just being around the people that you live with. And I know it's difficult. Trust me, I'm a single mother of 3 children, so I get it. We all need social interaction. We all want to be here for as long as our time is that we're to be here. And so
Yeah.
it is important that despite how we feel and the exhaustion that we feel being socially distant, we recognize that it's for a reason. And so it is my hope that when the vaccine is rolled out to everybody, everyone will get it. Like Anthony, I've had my first dose. I get my second dose tomorrow morning at 8 o'clock, and I will be there on time.
Amen.
Yeah.
It has not been trialed in children, and so I have 7-year-old twins and a 9-year-old daughter, so they will not be getting it anytime soon. But for the adults that can get it, I think we should move forward with enthusiasm.
Amen.
Get it, and that Earth can open again, and that we can live the way we lived before, even if it's with restrictions.
Right.
Yeah. So I think Dr. Fripp, I'm not sure if you guys have recognized this yet, but I think she has another calling on her life too, because every time she speaks, you leave a little bit more motivated, a little bit more inspired. Like
Amen.
she's like preaching the gospel, and I'm listening to you, Alicia, say amen, amen, because that's gonna be her later career, But again, like it is just that was my question. Like, what are the differences? And you guys have really touched on that. What are the differences between the vaccines? Because there's so misinformation out there that you don't know. Like, should I get this one or should I get that one? But I'm glad to hear that they're along the same rate in terms of efficacy.
Oh yeah.
Yeah. And so do they think that to be the same for the Johnson and Johnson?
I'm not sure. Yeah.
I have to check. So I know they're still in the process. So the AstraZeneca, I know, is the one that's next up, and that's about 75-77% efficacious. But I'd have to check on the Johnson and Johnson one. I wasn't sure. Is that one of the two that are? So there are a total of 6. Based on, this is from Dr. Hildreth now. He's the president of Meharry Medical College. So he says there are actually 6 trials. The 2 that have come out, the Pfizer and the Moderna, and then the next 2 that are coming out of the AstraZeneca, and there's another one, I think it's Solara. Oh, don't get me wrong. But I have to check. Do you know the actual name of the Johnson & Johnson one?
I do not.
Okay. All right. I have it here in my notes.
I just heard it on the news, and I was like, okay, Johnson & Johnson's getting in the game. Okay.
Yes, but I think they're in the 3rd tier. Yeah. I think so. Like I said, there's 6. We've already got 1 and 2, 3 and 4 are coming out, which one of those is AstraZeneca, and then 5 and 6. Oh yeah, no, you're right. Okay, yeah, AstraZeneca and Johnson & Johnson. It's called Johnson & Johnson. That made its debut September 22nd. So yes, they are number 4 that's going to be coming out. And then the 2 that are last are Novavax and Sanofi. And those were both approved to start their trials in December. So those are the ones I do believe that have started enrolling children. They're at the very beginning of rollout. But they're the ones that started enrolling children. So I don't know. I just know that AstraZeneca is about 75-77% efficacious. I'm not sure about Johnson & Johnson. But you're right. They're next in the pipeline.
Yeah, I saw that. I was like, oh, okay. So there's another question that came in. Are the possible side effects the same for both? Are we seeing a similar percentage of side effects for both? Are minority populations seeing a larger percentage of side effects? That's a great question.
Yes, the possible side effects are the same because they're both using the mRNA technology. We are seeing a similar percentage. I will say that I want to say Pfizer is the one that came out with they had more Bell's palsy. That it was 4. I mean, less than just general population. Right. My husband got Bell's palsy when we were on a cruise, but 4 or 5 years ago. So it can happen randomly. It just happened to happen after these people had these vaccines. So it wasn't a direct correlation, if you will. And then no, minority populations aren't seeing a larger percentage of side effects. I'd have to give you specific numbers, but I mean it's super random. Yeah.
And the reason it's comparable because one of the historical issues is that with our mistrust in the healthcare field, we wouldn't enroll with these trials. Yep. But both of these vaccines that have been currently approved, the percentage of minority participation was good. So therefore, there's no discrepancy in what one ethnic group sees or over another. And just to review, the common side effects are fatigue, headache, some nausea, severe chills. And it seems like more people have it after the second dose of the vaccine. So, Dr. Fripp, you be cognizant of that. And
so you're so right. You're so right.
Yeah. So the second one is.
So the one thing I will say is the Moderna vaccine does have an increased incidence of facial swelling in patients who've had dermal fillers. So that's what the American Society of Plastic Surgeons has put out so that people know. And what that only means is that you need to pre-medicate before your second dose. So as a plastic surgeon and a plastic surgery patient, I have dermal fillers, right? So then tomorrow morning, my purpose will be to take Tylenol in the morning. I also will take a peptide just because I have GI issues. To prevent that side effect. And then when I get home I have to operate tomorrow. So when I finish operating, though my 2 cases were canceled, I have a case at a surgery center that is still on. So after my surgery center case is on and finished, I will probably take a Benadryl just because I don't want to have that side effect. But like like Alicia said, there were small numbers. I mean, this is like 4 people and all the numbers study, but remember, 4 only matters if it happens to you. And the way I don't care if it's 0.5%, if I'm in the 0.5% of people that it happened to, right? So you always have to say, so the 0.5% of people had a complication, and what did you do about it to make them better? So we have to get away from saying that in minority populations, these things happen to us. If that is true, it's true. What do we then do about it if it happens to us? Right? Because everything has a side effect. Crossing the street, getting in your car, pressing that start button has a side effect, right? So we can't live our life scared of the side effects. We have to ask ourselves, if the side effect were to happen to me, what would I then do? And so I encourage all my patients who have a history of autoimmune disease, who have a history of allergies, who even seasonal allergies, to pre-medicate before they take that second dose.
And I would say, my first dose was actually worse than the second. I had minimal arm pain with the second.
Okay.
I mean, the second one was actually great for me. And I don't know if that T cell memory was coming through for your sister, but I mean, the first one, it wasn't bad in the first place. Arm soreness, headache, and I think I had a little bit of fatigue. But second one, arm soreness was gone. But then, like Roz knows, I kept working out. So
yeah,
I didn't go to do what I wanted to do.
Yeah. That's the one thing I remember from you, Dr. Alicia, is that you were working out.
I was working
out. Moving. We had another question that came in. So some of these comments some are coming through Facebook, and I think I'm reading the ones off of YouTube. I'm not sure where they're all coming in from, but Andrea says, my brother had COVID in November. He still has really bad headaches. Another friend talked about pain down to her bones.
Yep.
Do you see this in your patients?
Yes.
Yeah.
Yeah. And that's why I often tell, the mortality is obviously the most extreme issue that you worry about. But, as Alicia mentioned, even for those individuals who get COVID and have milder symptoms, they tend to, a significant portion of those patients have these symptoms for a prolonged period of time. I know runners who it took them roughly 4 to 6 months before they were able to run again.
Wow.
Right.
We have to take, we have to also take that in consideration. This thing has this is what we call morbidity. So the mortality obviously is death, but the morbidity is the respiratory issues, the neurological issues. And these are often protracted, meaning that they last a significant period of time.
Yep.
Yeah, it's just so scary. It's the unknown, and I think we're just still also scared. I remember when COVID first became a thing, I literally was driving myself crazy, taking my temperature every single day. And every like morning, noon, and night, because I was like, if I don't have a temperature, I don't have COVID.
Right.
Like, because I was still out in a community working before they really shut us down.
Right.
And I will say this about the DMV, the DC metro area. I think they have done a fantastic job in terms of shutting us down. I think the mayor of DC has done fantastic. Mayor Bowser, she's not playing with anyone when it comes to COVID. Even with this inauguration, she was like, "Stay home, don't come."
Yeah.
She's really been doing a great job. The governor of Maryland, I think he's done a great job, even in terms of. I think he went to the Philippines to get tested because his wife is Filipino, and I think he brokered some kind of deal to get tested here because we didn't have enough tests coming in. And so I just, it just, the fear of it, I think, is the scary part.
Yeah.
And the fear of the unknown of this vaccine. I think we're all freaking out about this vaccine. Should we take it? Should we not take it? Is it good for us? Is it going to kill us? And I want to get back to what you said, Dr. Fripp. So if we do have a side effect, how do we fix it? So how do we fix something like Bell palsy?
Bell's palsy, when you first diagnose it, you would treat that person with steroids to try to get the inflammation under control. I think we have to focus, and it's very difficult for me because I understand both sides of the coin, right? But I really can't entertain any type of opposition to the vaccine. It's difficult for me to entertain that because we need to get on the other side of this. It has been almost a year that we have been in this social distancing, social isolation. And so we know how to prevent it. I think for me, I wash my hands. I'm a surgeon, so I wash my hands 1 trillion times a day just in what I do, right? And then my kids wash their hands. I don't know why hand washing was something new for Americans. We just need to get on board. Even if COVID wasn't existing, right? We need to be washing our hands. Maybe I'm from the South and that's what we do. So we need to introduce that to the rest of America. But hand washing is something we never need to abandon. Social distancing, I can understand that. We're not used to standing 6 feet apart. But what people need to know and understand is even after we get the vaccine, we still need to follow these practices, right? Because it's not instantaneous. You get the vaccine and you could never get COVID. You can still get COVID after you get the vaccine. The hope is that enough people get it that we develop that herd immunity that you hear Fauci talking about and the science is talking about, right? So when you have side effects from anything, then there has to be what we call an antidote in medicine. And sometimes there are, sometimes there are not. But if you talk about, for instance, the number one thing I was scared of too, I'm thinking, I don't want to have the side of my face paralyzed. I'm single. I'm still out here mingling, right? So.
Amen.
Listen,
with the face palsy might not be a good date. So, but what you say is things have treatment. So before there was COVID, we knew about Bell's palsy and we knew how to treat that. So whenever you feel yourself experiencing things, and that's what Dr. Alicia was talking about, there was a people staying at home, not seeking care for things that occurred during the initial crisis. We need to, when you feel that there's something going on, because you're the best historian of your body, right? Seek assistance, go into the emergency room, call your primary care physician if you have one, get that checked out, because there are, we learn in medical school, there are things that we can do for most occurrences, but if you're at home, we can't do those things, right? So if you get the vaccine and you feel like your body's not right, you feel different in any way, seek the assistance of a medical expert like Alicia. She is frontline for a reason, right? You may not see me, and trust me, you don't want to see me because I've forgotten all this stuff. Trust me, if you fall on the Lord, not want to get elevated with me because I'm be like, what are you supposed to be doing, right? So you want to seek, though, the advice of a medical professional if you find yourself having those side effects. But by all means, if your number is called, if you're given the opportunity to get the vaccine, please show up and get the vaccine.
Amen.
Yeah. As I was sharing with you guys, my husband is taking the first dose. I'm trying to schedule to get my dose. I'll be honest, I did have to talk myself into it to get the vaccine because it seemed like it came out of nowhere.
Yeah.
It's like How is this vaccine ready?
Roz, that's not true. See, they were working on mRNA vaccines for a long time.
1995. First
1990.
time the technology came out. 1995, honey.
Yeah.
So see, that's why I'm happy that
Yeah.
you guys are here, because I know to go do the diligent research. I was like, okay, what is happening? And then when I started hearing that this wasn't something that just came out the blue, that this is definitely something that has been in the mix, I was like, all of us don't know that.
Right.
All of us
Right,
don't know
right.
to go look in journals.
Yeah.
All of us don't know to go research. All of us are like, what? And I've heard this. I've even heard this. How did they? Because people think that a vaccination is the cure, right?
No, right.
So I've heard people say, I've seen memes like, how did they get a cure for COVID, and we still got HIV running around here for 30 some odd years? And so it's those things that our community has to be educated
So,
on,
Roz,
because
yourself, when was the last time you heard somebody die from AIDS? So
yeah, I know. I
HIV.
know.
You can have HIV. When was the last time you heard that somebody died from AIDS? You
Okay.
haven't heard that because of with the medications that are out there and how we treat people who have HIV before they get to AIDS. And likewise, this mRNA vaccine and the mRNA virus has been studied for years. It is because the pandemic allowed us to not have so many roadblocks in the development of the vaccine. So we decreased the roadblocks that we typically have because it was a pandemic, and we were able to move faster than we've ever been able to move before because we decreased those roadblocks that are in place, right? And the studies are smaller than they typically are when you talk about vaccines. But when was the last time you heard somebody die and say, my uncle died of AIDS? That you don't hear that. Insured or uninsured, you don't hear that, right?
Yeah.
So that's
That's awesome. That's
Yeah.
awesome.
So let me expand just real quick so everybody is very clear on this. So it's been what we call like a paradigm shift in the way vaccines have developed. So first of all, as everyone said, the mRNA technology is not new. This is the first time it's been applied massively, but it's not new. The second part is that, vaccines really would undergo an antiquated process where you'd have to go through phase 1, phase 2, phase 3. You go in sequential order before you get approved for the masses. Well, what was done with this vaccine was, instead of going in sequential order, we went in parallel. So I think what COVID essentially did is it forced the medical community to revamp the way we test and release vaccines because there was a real need. And that, I think, is important because it does, on the surface, it's like, wait a minute, this came up real quick. Like, how did that happen? But when you really understand how it came, then you realize, okay, they changed the approach. The second piece I just want to really emphasize, and when it comes to the fear aspect, fear is mostly false evidence appearing real. People are so hung up on what they fear versus what they know. What we know is COVID can kill you. What we know, COVID can put you in the hospital for several weeks. What we know is it's killing Black people more than it's killing other people. So, everything in life has its risk benefits. Some of y'all go out and drink, and y'all know y'all shouldn't get in the car afterwards and go home, but you do. Risk benefit, it's the same thing. And I think that we have to get beyond this fear and start taking care of us, because the same fear prevents us from seeing physicians annually to get our blood pressure checked, to make sure we don't have diabetes. So this COVID is really just an extension of all of that.
Yeah. And you bring out a great point, because I mean, you do have to kind of, I had to have the come to Jesus moment with myself. I had to say, I haven't seen my mother since COVID has happened, because I want to protect her. I want to see my mom. I mean, I've been seeing her, she's in Georgia. I'm here in the DC area. And we do video and Zoom and all that, but I have not physically held my mother.
Isn't that crazy?
And the holidays, and it was hard for me. Because I'm typically in Georgia for the holidays with my family, amongst my family. And, because my husband and I wanted to be safe and to protect our family, we didn't travel. We listened to the CDC guidelines. But I'm not going to sit up here and act like it wasn't hard. So it became very easy for me to accept this idea that I'm going to get vaccinated. Because it's like, I want to see my family. I want to get back to life. This is a vain reason. I want to go back to homecoming. Just
Okay, that's real.
I want to see my friends. I literally one Sunday I just woke up crying because I wanted to go to brunch. I just wanted to have a girlfriend moment with my girl,
Oh.
you
Mhm.
know. And so like as a psychologist, my clients are really, really struggling with the social isolation. So I'm dealing with it on the psychological end. But you're absolutely right. This pandemic has brought forth all of our medical issues, all of our psychological issues. And I think we don't pay attention because our lives are still going. We weren't paying attention.
Mhm.
And now that I always say this pandemic is a blessing and a curse. It's a curse because we've lost over 400,000 people now.
Mhm.
But it's a blessing because it's an opportunity to reset. It's an opportunity to have some introspection about how you're living your life. It's an opportunity to, I have done more research on sea moss gel, elderberry,
Lord have mercy.
berry.
And
But
that
I
sea
mean,
moss is supposed to be good though. So
yeah, I'm like, I'm going to order me some sea moss gel. I'm putting it in my hair. I'm putting it on my face. I'm putting it everywhere. You know, um,
like cocoa butter.
yeah, like cocoa butter, because I want to live and I want to protect myself. And it's like, it has given me the opportunity to become really cognizant of what I wasn't taking care of in my life, what I wasn't being aware of, if that makes sense. And, I wanted to do this show because I really wanted to talk to our community directly
Amen.
because we just don't. Anthony, you touched on it when you said that, it's that same fear that stops you from going to get a yearly physical. People really live in that world of, well, I'll find out, but when you find out, it's a little too late. Like, you could have been preemptive. And so if we really could change that ideology that, it's my time, or live my life, or all the crazy things that we tell ourselves. I think that we could be better, and this disease would not have, well, this virus, excuse me, would not have affected us in the way that it has.
Mhm.
Yeah, COVID unfortunately has really just exposed the underlying issues in America when it comes to equitable health care and the socioeconomic factors that affect different communities. It's all it did. I mean, so
Yeah,
for me personally, while we talk about COVID, I honestly think it's a bigger issue that we're really talking about, because a lot of the same concerns people have about the vaccine are not specific to the vaccine. They're more general concerns that apply to the healthcare system. However, there are other aspects such as access to care that obviously play a role as well. That's why, I feel strongly that we can't create a hurdle in a system that already has enough hurdles set against us, if that makes
Mhm.
sense.
yeah,
Right. So people get the option to get the vaccine and they don't want to do it because they fear XYZ. Well, here's the one opportunity where the healthcare system is providing you, access to something that we need more than other ethnic groups. This is the reality. So I think I just encourage everyone who's listening to this, whether live, recorded, investigate for yourself. Don't believe everything you hear. Don't believe half of what you see and none of what you hear. So you got to investigate yourself, because I was a little nervous about the vaccine until I read about it. Until once I was clear about how this process played out, I got the email that I could sign up. Within 5 minutes, I had that appointment set.
yeah,
Mhm.
And I don't even like the flu vaccine because I never had the flu. So I'm not
I
a fan
agree.
of it because I never had it, but the hospital makes me get it. But for this one, I was there the next day, bright and
yeah,
early.
I agree. I told people jokingly when they first talking about a vaccine, I'm gonna let you get it first. Then once
yeah,
you get it, then I'm gonna get it, right? And I said that, and then I thought about myself because I'm like Anthony. I get the flu shot. I've told them for years I was allergic to eggs while I was eating the egg, right? So it
Lord.
was not until they told me in my new job, oh, we have the egg free dose. I'm like, God, oh my God, what? right? And then they threatened to garnish my wages, and then that made me go the next day. Um, Vaccine with this vaccine, my name was called because I was not in the first group. I'm not frontline in the traditional sense, right? So I was in 1B from my hospital system. And when my name was called, I'd seen my partner get it because he's frontline, and I'd seen that, I want to be here. Like I want to be on this side of COVID. Like I don't want to be on the other side. I don't want to be intubated. I don't want to have those severe treatments required. I want to be on the side where I am fully vaccinated. So when I get it, if I get it, right, then I will be able to survive this.
Yeah.
Meanwhile, y'all, I had no reservations.
No reservations, right?
Having experienced it, like if you've never experienced trying to, I would akin the shortness of breath to trying to breathe through a straw underwater. It was, you just cannot get enough air. And I have a very short torso, so every pregnancy I had like no residual, I had no residual lung capacity, and that was hard by the end, but there was nothing that can compare to that shortness of breath. There's nothing that can compare to that. I had my first migraine. My eyelashes hurt. How your eyelashes hurt? Like if I could give myself an opportunity to never experience any of that again, sign me up. First in line, please.
Yeah. I'm excited to get it, and what made me ask you guys is because I loved your social media posts. How you were like, I'm doing this for my family. I'm doing this, for my community. That and just the way that you spoke about it was very inspiring. That I was like, okay. And I was so happy because I was very terrified that I wasn't going to see us getting vaccinated. But I was so happy to see so many of our Fiskites, were getting vaccinated, from our nurses, our nurse practitioners. Like I was like, look at our Fiskites, look at everybody getting vaccinated. I love it. I love it. I love it. There's a question that came in. Is it possible the first cases of COVID were late 2019 rather than first quarter of 2020? I was very ill Christmas to New Year 2019. Went to the doctor 3 times. They had no idea what was wrong. Wasn't sick in 2020. I'm not.
I say highly possible.
Yeah.
I think we will be speculating, but I strongly, I have a good friend who also had a similar, illness late 2019, and we didn't start testing it until it was on the radar.
Right.
And I think it would be it's highly probable that this thing was around before we knew it. No question.
It first showed up in Wuhan in July of 19. So
to think that it didn't spread far. It's like this variants, right? They start finding it, and next thing you know, it's everywhere. It's probably been around, right? We're just now looking for it, so we're detecting it.
Right.
Yeah. And there are other questions coming in. Sorry. Just want to make sure that I get to everyone. Oh, this is for you, Vikisha from Shamani. He's like, I'm from the north and we wash our hands too.
No, I'm not saying that you don't wash your hands. It's not like a southern hand wash, baby.
I'm southern cooking.
I'm so glad you wash your hands.
Yes. Shamani says he washes his hands too. Andrea says, come on, Anthony, you were preaching the gospel to her. TJ, to Warner Woods, TJ, she said, good information. Thanks for sharing your knowledge on the topic, docs. Jackie Harry said, agreed, the holidays were extremely rough. I'm ready, vaccinate me. And I think Jackie's a teacher too. So yeah, I'm pretty sure she's ready to be vaccinated. And Tiffany was just agreeing. How long is the vaccine effective? I got a question that came in.
That's a great question. I know I just read today that Moderna said that their vaccine is effective for at least a year. It's important to point out that, so if you get COVID, what studies have shown is that your natural immunity can last up to 6 months. It's variable. It can be shorter, but people can confer some level of protection for 6 months. The vaccine data is still, that's one of the things about an EUA, emergency use. You know, it's still some information that hasn't been ascertained. But the Moderna, I'm not aware of what the Pfizer, you know, folks are saying, but Moderna, they're suggesting at least a year. Hopefully, is 50 years, but you know, we got to start somewhere.
Yeah, New England Journal of Medicine actually just reported, I think it came out on the 19th, that they can say with confidence 4 months. With confidence, 4 months. But they are hopeful that it would be a year. So it would be an annual vaccine like the flu.
Yeah. And
I know that's not what a lot of people want to hear. I think as the technology continues to be worked on, we can try to make it, you know, more longer term,
Right.
like Hep B and all that. But
yeah,
might be doing the same
That
thing.
makes sense. I mean, because it's kind of acts similar to the flu, and right?
Exactly.
We have to get, you know, annual vaccines. But look, this vaccine, you know, from what I recall, is at least more effective than the flu vaccine, so that's good.
Yes.
I had another question to come in. Can you still be a carrier although vaccinated?
Yes. That's why we still have to wear face masks. That's why we still have to socially distance. The vaccine, its whole goal is to reduce severity in the person that is vaccinated. It is not an immune creating product. So we can still get it because it's because it is 95% efficacious. There's still a 5% chance you can still get a severe disease. So we can still get it. We may have an asymptomatic infection and we can carry it to other people.
Right.
So the greatest scenario is if a bunch of vaccinated folks get together and they hang out, because their risk of infecting each other is severely low. But we have to still be concerned about being around people who are unvaccinated, because we can be an asymptomatic carrier just like anybody else and give it to someone unknowingly. So yes, you can still carry it. The whole goal is to prevent severity, very severe cases. We're reducing hospitalizations and ICU admissions and death.
Death. Yeah, exactly.
Yeah, I was like, so will it stop us from death? Another question came in. I tested positive and just completed my quarantine. Is it still recommended that I get vaccinated? Is there a waiting period?
Yes, the 90 days is the recommendation. So everyone has at least 3 months of natural immunity once they have the infection. Some are 60 days. I'm sorry, some are 6 months, and I mean, even me, I went almost 9 months. Praise the Lord. But 90 days is when we say yes, you have natural immunity. So the goal is so more people who did not have the virus or who don't have antibodies, that they go first and you wait your 90 days because you still have some natural immunity against it. So if you've had the virus, you can get it, you can get the vaccine, but we are hoping that you will wait closer to the end of the 90 days when your natural immunity would wear off, so that someone else who doesn't have natural immunity can get the vaccine first.
Got it. This is great information. Someone says, not sure if this has been asked, but what are your thoughts about the variant strains in the vaccine? Will it be effective against it?
Yeah. Did we talk about that before or during? I thought we talked. So
Yeah, go ahead.
that was before.
No,
Okay, I think it was
asking
before.
about the new strains.
Yes. So what we found is that the vaccine is able to fight off this new strain. So the good news about it is that the base of the virus is still the same. It may mutate, but the base is still the same. And once exposed, after you've been vaccinated, you still produce a spike protein against the virus. So even if many parts of it mutates, you still have that spike protein against COVID itself, and it will help you fight off the virus. So that's why we're finding, even with this variant, it's a lot more virulent. So a lot more people are getting it, but they're not as sick with it. So that's a good, I mean, obviously we still don't want any more mutations, but they're going to be mutations. But that's good for those of us who are going to be vaccinated, that no matter how many ways, how many times it mutates, our spike protein in our bodies will still be able to fight it off because it still recognizes the base virus.
Got it. Dr. Anthony, this is for you from Rashida Malvo. as a transplant doctor, can you talk about the vaccine and the impact it could have on a transplant recipient? Well, that's a good question.
That is a good one.
So, as I mentioned earlier, the CDC is now officially recommending this vaccine for all immunocompromised patients, so transplant patients, patients with GBS, etc. The caveat is that the safety data is still not fully elucidated because, as I mentioned before, when the initial vaccines were tested, they were tested in people, over the age of 18, etc. It didn't include pregnant women. It didn't include kids. It didn't include transplant patients. But the issue with transplant patients and vaccines are the vaccines that are live attenuated vaccines. So that means there's certain vaccines that you received in childhood that have some live weakened versions of viruses. And those vaccines are the ones that transplant patients cannot take because of their compromised immune system. This is mRNA technology, no live vaccine. It can't give you COVID. It can't change the DNA, et cetera.
Amen.
So
Amen.
we feel pretty confident that transplant patients can take this medication. And my hospital is officially vaccinating patients. I know Emory in Atlanta is. I think Hopkins is. I think there's several transplant centers that are now officially doing it. We're just making sure that patients are about 6 months outside of transplant. They have no evidence of infection. They have no evidence of rejection. So all my patients who call me, I'm advocating for them to take it.
I am so sorry, Dr. Watkins. Can you repeat that one part one more time about not altering your DNA? I don't think the people in the back heard you.
I slipped that in there.
I don't think the people in the back heard you though.
It doesn't change your DNA. You're not going to grow 3 eyes.
Come on.
It doesn't work like that.
Come on. Let's do it. Let's do it.
People, it doesn't work like that.
Awesome.
I'm sorry.
Dr. Anthony, so I just got some people just had a revelation that you are the doctor that was on the show with Dr. Oz. There was a show that you did with Dr. Oz.
That has nothing to do with COVID.
People just recognize you. So I just got a Facebook message. That's the fine black guy that was with Dr. Oz.
Oh, the fine.
Wow.
Yeah, yes. I was on a little TV show when I was training with Dr. Oz. That was a good experience. That was I. Yes.
Yeah, I was like, I'll mention it. I probably just embarrassed the heck out of her, but I was like, I'll mention it to him. Back to the effective for 4 months. Does that make people vulnerable and susceptible after that time? After the 4 months, like, do they need to?
If we're still face masking, social distancing, doing what we need to do, then I would say no, but it does. I mean, honestly, if we're just gonna lay the carpet out like it is, if it really is only 4 months, then yes, we will be just as susceptible as anyone else. But we're praying. I mean, we don't know, but we're praying that it will be longer than that. But with confidence, 4 months, you have a decreased chance of having a severe infection.
So what is hold on, just got another question in. What is the new information regarding COVID and anticoagulation?
Well, I don't know if it's new information. I mean, what happens is, unfortunately, a COVID infection increases your risk of thrombosis. So, for example, when I was working in an ICU back in March of last year, every patient who came into the hospital was receiving medication to thin their blood to prevent clots from forming. So that's not new data. That's old. I'm not sure if every patient is getting that treatment. I think
only severe.
Hospital, only the severity of your illness will dictate whether or not you receive that.
Correct. Correct.
But there's a known correlation.
Right.
Yeah.
Very good.
I myself take a daily baby aspirin ever since. So
yeah.
Those patients who we electively operate on who've had the diagnosis of COVID, we stratify them as regarding the risk, right? So every patient is stratified for their DVT risk. In those patients who are at higher risk, we go ahead and treat them, right? So we used to treat patients who were, let's say, in the high category, this low, medium, high, right? But we even look at those patients who were in the medium risk to see if they need to be on anticoagulants too. Because remember, the majority of what I do is elective. So to have a complication for an elective surgery is really not what you want, right? So we're looking at that medium group in plastic surgery to see if they need to be treated if they had a COVID exposure or if they were COVID positive. Yeah.
Very good stuff. Guys, I told you only an hour. I'm so sorry. And so many questions came in that I wanted to make sure that I got all the questions, but I know some of you guys had a hard stop. And so I absolutely want to thank you for showing up today, for speaking to our community, for sharing your truth, this wealth of information, this great information. My heart is full because first of all, because I love Fisk. Fiskites mean everything to me, and I'm so happy to just be amongst such intelligent individuals that I was happy to say I was on the yard with at some point, and to see you growing in your career and being fantastic and saving lives and helping lives. Tonight has been wonderful, has been wonderful. But before we leave, I would love for you to tell people how to reach out to you. So we have you on top, Dr. Anthony Watkins, if you could tell people how to reach out to you. They have
Yes. So I guess the best way, Instagram, A Watkins, DM me. I do answer questions. My mission is to educate people not only on this, but anything health related is best of my ability. Obviously, I don't know how this works if they can see it on my Facebook, but Instagram is probably the best method. A Watkins, and thank you again, Dr. Roz.
No, thank you. Thank you for saying yes. I know you're busy. I know you all are busy. So I'm grateful that you said yes and on such short notice. I think I asked you a week and a half ago, and you guys
Clear my schedule.
I'm grateful.
All the things we do for Dr. Roz.
I'm so grateful. Dr. Alicia, how can they reach out to you?
I would say same IG. So I am Mrs. MRS doc mom, MOM. So Mrs. Doc Mom. And they can, I guess DM me. Ooh, that'll be interesting.
Medical related DMs though.
I'm like, I don't know about that.
What am I saying? What am I saying?
I am open to come. If you go to my page, I don't even know. I don't know my settings, but if you go to my page, you'll definitely see my journey along my vaccine. My vaccine journey. And you can ask questions about what I've experienced, but I'm pretty much an open book in terms of that. I want you to know the good, the bad, the ugly, and you can ask me anything about it.
All right, and Dr. Fripp, how can people reach out to you?
So my IG is drv.fripp. So Dr. V.Fripp. And I just want to say, I'm clearly the eldest, though. Hopefully it's not that obvious. But
it is not, ma'am.
It's not.
It is not.
I can't be more proud of y'all if I tried. I mean, I could be prouder. Oh my God, I could not be prouder. Alicia, I didn't know you on the yard. I graduated in 95, but I graduated in 96, but I left in 95 to go over to Meharry. So I didn't get the pleasure of meeting you, but oh my God, my heart is so swollen. Oh my God. Transplant surgeon, you make my heart smile every time I hear your little name. And at least your little face just makes my heart explode with pride. It just does. And Roz, you'll always be my little girl. I mean, my God, Pi Chapter Soror just doing amazing things. But our root is Fisk, and what they say always is Fisk forever. And I will not be
forever.
Proud of you all.
Forever.
Try to be prouder, I couldn't. And so it is my absolute pleasure. And Roz, when you asked me, my first response was absolutely.
Absolutely.
You always say yes, and I appreciate it because I love just sharing the knowledge from you all. And the way that we help each other is by sharing with our community and making sure our community is together. I mean, today has been fantastic.
Wasn't it a great day?
It's a great day.
It's a great day.
Great day for HBCU graduates. great day for Divine Nine, and certainly a great day for Alpha Kappa Alpha Sorority Incorporated. So,
and African American females. Hello.
yes. One thing that they can never say, well, they couldn't say it before, but now they can't say it at all, is that you can't count out an HBCU grad.
Okay.
You can't count us out. The wealth of knowledge that we bring is unfathomable.
Second to none.
Second to none. But I want to thank you so much for participating in my second season opener. Thank you for being my first guest for season 2. Thank you for being on the front lines. Thank you for everything that you do. And I love you all. I love you all from the bottom of my heart. And I'm just so immensely proud. So immensely proud. And thank you for the knowledge that you shared tonight. And I will give this to you so you can share it with your networks so that they can get the information as well. Thank you, everyone. Thank you, everyone that joined tonight. Thank you for your great questions. I think I got to all of them. I hope I did. I was between devices trying to get them all. So I hope that I got your questions answered. But if not, you can reach out to these lovely professional doctors, and I'm pretty sure that they will answer your questions. Thank you again for another great night on the Dr. Roz Show. Have a blessed night, everyone.
Awesome. Thank you, Dr. Roz.
Thank you.
Love you.
Did you need anything else?